Brief history on the coronavirus. Coronaviruses are a family of viruses that can cause illnesses such as the common cold and severe acute respiratory syndrome, also known as SARS. In 2019 December, a new coronavirus was identified in China as the cause of a disease outbreak that originated in China, Wuhan. The virus is now known as the severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2, and the disease it causes is called coronavirus disease 2019 or COVID-19. The coronavirus which causes COVID-19 originated in the city of Wuhan, China. COVID-19 is believed to be transmitted primarily through inhalation. Once infected, most people experience mild symptoms including sore throat, headache, fever, a dry cough, shortness of breath, and fatigue. However, in a subset of patients, the virus attacks the lungs, causing a much more serious infection. Small air sacs in the lungs add oxygen to the blood cells. This oxygen is then transported to organs and tissues throughout the body. When the coronavirus attaches to a cell, it begins to replicate within the cell. The body's immune system attempts to destroy the virus, which results in an inflammatory response that causes fluid accumulation in the lungs. As the lungs fill with fluid, the body's available oxygen decreases, which can lead to shortness of breath, organ injury, and even death. And fever is due to the presence of infection in the body. The risk of serious complications increases if a person is elderly or has associated medical conditions. Although there is no vaccine yet available to prevent with the new coronavirus, you can take steps to reduce the risk of infection. The World Health Organization recommends the following precautions for avoiding COVID-19. 1. Avoid large events and mass gatherings. 2. Avoid close contact with anyone who is sick or has symptoms. 3. Wash your hands often with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer. 4. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. 5. Avoid touching your eyes, nose, and mouth if your hands are not clean. 6. Avoid sharing dishes, glasses, beddings, and other household items if you are sick. 7. Clean and disinfect surfaces you often touch on a daily basis. 8. Stay home from work, school, public areas if you are sick unless you are going to get medical care, and avoid taking public transportation if you are sick. 9. Avoid contacts with live animals. 10. Avoid eating raw or undercooked meat or animal organs.